Hi, friends and family. It's been a few days since I've come onto YouTube to share my thoughts, and I just wanted to come back and give some updates and just kind of let you know what's going on out there. I know we're all like stuck in our homes and wondering what's going on around us, and we kind of have to trust what other people are saying, so it's kind of weird. But so this video, I'm going to talk about testing, some good news which we all need to hear, kind of expectation for what's coming, what to do if you get sick, and maybe some other little tidbits thrown in there. So my name's Hannah. If you haven't watched any of my other videos, I'm an ER nurse, married to a family physician, and so we like to talk about medicine a lot. And it's fun. But yeah, so that's kind of my perspective on where I'm coming from. And I was at work today, and it was a good day. So first thing I want to talk about is this testing. I was talking to Steven about it a little bit ago, and I would like the availability of testing, and he was like, the fact that there is none, which is not entirely true. There are some tests out there, but they are very limited. And so if your doctor doesn't offer you a test, or you can't get a test, it's because there hardly are any currently. And we're saving them for our critically ill patients. So the good news is that you don't need a test in order to be treated for COVID, because we don't really have a lot of treatment. Oh, that's one more thing we'll talk about, treatment. And we're gonna treat you in the hospital like you have it until we know that you don't, because we need to isolate you and keep you from spreading the disease, keep ourselves safe. So pretty much we're gonna assume that you have it when you step foot into our hospital until you give us a good reason that you don't, via medical testing and all kinds of stuff. But anyways, so that's that. There's very limited testing. So what that means is that when you look at Tulare County today, and it says that we have 16 positive cases, you just have to remember that there's a whole lot of people out there who have signs and symptoms, but we have not been able to test. So if you keep telling yourself that we're doing a great job, that's great, but just keep in mind that there is a lot more people in your community that are most likely infected, but have not been tested. The other thing that we're finding is that most likely some people are testing negative when they're actually positive, which is understandable when you just have to come up with a test. You know, it's not like this test has been perfected over years and years. It's just been developed in a matter of weeks. And so it's very understandable that there might be some error in that test. So, yeah, so just keep that in mind. It's just a good reason to assume that everyone has COVID until you know that they don't. So that's testing. Good news from the ER. So here where I live, I don't think we have in any way hit the peak of our infection. So if you watch some of my other videos, I might explain this more clearly, but pretty much when people get exposed, it usually takes somewhere between 2 to 7 days for them to start having signs and symptoms. And then the first week that they have symptoms of COVID-19, they are or can be very mild. And then people don't necessarily or don't usually need this is what we know so far from China and other countries. People who need medical care don't usually need it until day 10 to 12 of infection. So I think the median or mean intubation day was like day 12. So that person has been infected for 12 days before they need to be intubated. So in my mind, I'm thinking, well, we didn't really lock down our community until like maybe 7 or 8 days ago. So people were still doing a lot of, like last weekend, everyone was like, grocery shop, because now's the time before we get locked into our houses. And so there was still a lot of exposure going on last weekend. I feel like over the course of this week, people have been increasingly staying home, which is really good. And people who weren't taking this seriously before, most of them have woken up to the fact that this is like a serious threat to our nation and the world, really. We still had a lot of exposure then, and I just think that we, in the next week or so, are going to start having those critical patients coming in because they're not to the peak of their infection yet where they're needing medical care. So that wasn't the good news. This is the good news, is that because today in the ER, we had just like nowhere near as many patients as we usually have. So we usually are just flooded with patients of all kinds. We have scraped fingers to people who are getting CPR. We just have this huge variety of patients, and we are trying to figure out at all times who's sick and needs emergent medical care and who's not, and who has chronic issues that can be taken care of outpatient or doesn't even really have chronic issues but has anxiety or all different other kind of things going on. So because everyone in the country has figured out that ERs are not a great place to visit currently, because people who do have signs of COVID-19 are coming to us for help and treatment. So by coming to the ER, you just automatically are placing yourselves in a population of people where you could be exposed. You guys all are like helping us get ready by giving us some space in our ERs, freeing up beds, and making our waiting rooms not so packed. And so keep up that good work. Keep taking care of yourselves at home. Keep thinking, if you are going to go to the ER, there better be a really good reason for it currently. Otherwise, you will be exposing yourself, most likely, on your way in. Once you come in, we're trying our very best to keep everybody separate and not exposing those who aren't already exposed. So that's some good news, is that people are making space in our ERs. You are making space in our ERs for us to take care of those who are really sick. And that's encouraging as an ER nurse. Never quite seen anything like it. Also, each day that we have before we hit like maximum capacity, if we get to that point, we have more time to prepare. Our administration has more time to prepare. Each day, each shift, each hour, we get more organized. We try processes and see if they work. And if they don't, then we're able to change them. So even just in this last week, I was just so encouraged at work today to be like, wow, we have really in the last week done a ton of work as a hospital, but also just, I would guess this is happening at hospitals all over the nation. We've gotten a lot more information over the last week. We have educated ourselves as medical professionals. We've educated ourselves over the last week. So each day that goes by, we are more ready to care for those who need to be cared for and who need some serious medical intervention because of COVID-19. Really appreciate what I just saw a small statement today from the Surgeon General, but pretty much just said there's no way to treat COVID-19 other than prevention, and prevention is people staying home and away from each other and talk about what to do if you do get sick. But we can intubate you and help support your airway, and hopefully your lungs improve. But there's a lot of people whose lungs just aren't improving after a lot of treatment and a lot of care. So, there's not something that we can necessarily fix for everybody. There are people whose lungs are improving after, being intubated and supported and stuff for a while, but that's not the case for everyone. So just don't assume that intubation is the answer, pretty much is what the Surgeon General said, and I totally agree. He was so clear on that. Let's see. Also, wow, we just feel your support as being a part of the medical community. Just feel your support from the general community, just surrounding us and looking for ways to bless us and encourage us and take care of us. It's amazing. Thank you. Just feel so supported and cared for and seen and valued in this time. And wow, just looking around, one of the floors in our hospital just converted themselves from an observation floor into a respiratory isolation floor. And I'm like, all those nurses are such champions, man. Their life has just gotten turned upside down, but they're still going to be showing up for work and taking good care of people and learning new things just like the rest of us. So, yeah, there's just a lot of people, not just in the ER. There's a lot of people in our hospitals that are just doing an amazing job, stepping up to the plate, and taking this thing on. So, good work, healthcare team. Proud of you guys. And thank you, my community, for supporting us. Also realize that as we go on here, in our kind of lonely isolation, and life being so different than it was just a week ago or 2 weeks ago, I just sense that there's going to be a restlessness to get back to socializing and seeing other people and stuff. And I just would ask, please continue to isolate yourself. Everybody is supposed to be kind of on a self-quarantine currently. And sounds like in LA this has been hard. Just from what I've heard, it's here in the Central Valley we can go outside places where there's we have enough space that when we go outside, and lots of people are going outside currently, we can be separated. But it sounds like that has been almost impossible in LA, which I can understand. There's just people everywhere. How do you get outside and not be close to someone else? I don't know. So just keep that in mind. If you live in a big city, getting outside is not necessarily going to be socially isolating, and you could still be spreading the virus while you're getting out, and you could still be receiving the spread of virus. So let's see. As far as getting sick, I would just, and I think the Surgeon General made a note about this in his memo that I read too, I would just assume that, if everyone just assumed in their mind that they had COVID-19 right now, we would probably be doing much better at quarantine. And from the studies that I've been reading, it's man, there's a lot of asymptomatic people. And those asymptomatic people who were actually tested and shown to be positive was because they were a family member, a wife, a kid of somebody who was positive. And so in my mind, it's there's just got to be tons of people out there that have either almost no symptoms or are completely asymptomatic, but are still carrying the virus. So what we need from you is for you to just assume that you have the virus and isolate yourself accordingly, because you very well could have the virus. They were finding that a lot of kids were asymptomatic, and I almost just wonder if it's those kids were tested because their parents were positive, And there's just as many like asymptomatic 20-year-olds out there, or 30-year-olds. We just don't know. That's part of the challenge of this virus, is it's also new. We don't know. We're learning as we go along. So assume you're sick. Just assume you're sick. It seems like, at least in our county, we have like the majority of our cases so far are in the age group of 18 to 40. I think that's a hard age for us. Like, we know that we're not in the like super high risk, high death rate kind of age bracket, but we are still carrying the virus, and we're still getting sick. We're not stopping the spread. And I think that's probably the age group that is taking this pandemic like the least seriously. And so I just encourage you, if you're in that age group, would you please take it seriously and just assume that you're a carrier. Okay, what to do if you can get sick, or if you do get sick. Sorry, not can. If you do get sick. The first thing I want to say is that some people, it's like from what I'm reading, some people are, bam, they just get sick. They have instant like onset of fever, dry cough, shortness of breath. They just have like all the classic signs and symptoms that we've heard over and over from the CDC and all the people for the last 2 weeks. But other people have super vague symptoms that come on really slowly. And so if you have body aches, or all of a sudden you're just fatigued, or you don't feel like eating anything because your stomach is just kind of nauseous, or you don't even realize you're nauseous, you just are like, I don't feel good, I don't want to eat anything, it's just not making me feel good. Please just assume that you have COVID-19 and stay home. First of all, don't worry, don't panic. Hopefully and very likely this could be a very mild illness for you. So don't panic. Second of all, stay home. If you start feeling sick or not great, don't run out for that last set of groceries. Elicit the help of those in your community and those around you. We are in this together. I just really feel that during this time. Number 3, the virus is spread through contact and through droplet. So what that means in the medical terms, I know those are kind of medically, but droplet means that if I cough at you, or if I cough in general, I can either, the droplets you can't see that have virus in them can either travel over to you if you're close enough to me and land on your eyeball, or in your nose, or in your open mouth as you jab at me or whatever, and you can get infected that way. The other thing that can happen is I can cough, and while I'm going to the bathroom or I'm in the kitchen, and those droplets can land on the counter, and they can live on the counter for 48 hours. So if I'm somewhere public, in a public bathroom, or I'm at the grocery store, which is really the only place you need to go currently, and I cough and my droplets land on something, maybe my cart or something else, then that virus can live there, they've found, for on plastic 72 hours, on metal, on stainless steel metal, I think 48. So that's one way it can be spread, and then also through oral or fecal secretions. So hand hygiene is so important if you get an infection. Just really everyone right now, if we're all assuming that we're infected, then let's all do great hand hygiene. Ask for help, like I said. Take care of yourself. If you've heard about the Tylenol versus ibuprofen / Advil thing, it's seeming to be legit research coming out. And it's also, part of the research of it is they've found that ibuprofen is less helpful in similar viruses that we've studied in the past. So at this point, I would just go with Tylenol for your fever if you need to do that. You can follow the dosages for your size. And another thing I like to do when I'm sick, these are just kind of nursey comments, like stay hydrated. I have a humidifier that I run. I just feel like any way that we can keep our lungs healthy is good right now. And like purifying your air, opening your windows, letting fresh air come through your house. And if you live in a climate where you can do that currently. If you need to seek, there's also some homeopathic stuff. My family is great into that. My nursing brain isn't always on board, but there are some helpful like homeopathic treatments you can look into, including garlic, oregano oil. I'm sure there's others. Those are just kind of the ones that I've heard about recently. And yeah. Oh, tea tree oil. Those are some different things. Okay, if you need to seek medical attention, you can call your PCP. Also, most hospitals right now are rolling out telehealth. So that means that if you're sick and you feel like you need to talk to a doctor, I know tonight Kauai just released their telehealth line. So you can actually call and talk to a medical provider on the phone without having to go into a clinic or the hospital. They can ask you questions and kind of help you know how to go from there. So check in with your like local hospital. A lot of them are doing a ton of outreach and education to the community right now in really strong, powerful ways. So reach out to them, stay in touch with what they're saying. It's important, and they have some great resources for you. And then if you do need to come to the ER or seek medical attention, please wear a mask if you're able to, or put one on as soon as possible, covering your cough if you don't have a mask on. Reasons to go to the ER, we've talked about this in the past, but if you develop chest pain, shortness of breath, that's severe and doesn't go away, one way to know that is like, are you able to speak a whole sentence without like taking a like having to pause and take a breath? Like right now I have no problem speaking lots of sentences without taking a breath or pausing. But if I am really short of breath, I might only be able to get a few words out in between each one of my breaths. I'm also going to be like using my shoulders and all my muscles in my chest. If you've ever seen like an asthmatic kid or someone with asthma, then you probably know more of what that looks like. Also, if you or someone with you starts developing like blue lips, kind of blue discoloration of the face, that's a very good reason to come to the ER. And if someone with you is starting to become altered, have an altered mental status, meaning their brain they're not making sense, they're really hard to wake up, things like that. Those are good reasons to come in. Let's see, another thing I was gonna say, some of you guys have asked about like, hey, have you heard about this treatment that people are talking about? And yes, I've heard about some of them. I haven't spent a lot of time researching them. I have read a few articles about them, and they do seem like possible, like promising avenues. One thing that I have heard a lot of from like our pharmacists and stuff is that we don't have a lot of supply of these medications. So it's kind of the whole supply thing again. One of the medications like is hardly available at all. And so even though that might be something that's helpful in the long run, like in a year, we might have a great supply of those medications. And in a year, we might have a totally different perspective, and we can put all the research that's happening currently with this new virus we've never seen before together and provide like better care and better like outcomes and all that stuff. But currently we are like in the beginning of experiencing this pandemic. So yes, there's possible medications. They're not necessarily super readily available. And so another reason why we need to lower the curve so that we have the medications, the resources, the ventilators, the staff, all those things so that we can take the best care of people that are sick and not exhaust our resources. And you are still a huge part of that lowering the curve. Vaccines, that's great, but it most likely will take, I've heard the most positive I've heard is 6 months, but most of the things I've heard is a vaccine is at least a year out. Even though they're already starting testing, they're already developing. Vaccines don't just come overnight. They have to be developed over time, tested, and all kinds of things. Let's see. Symptoms. You can have symptoms of COVID-19 from anywhere from 7 all the way to 25 days, which is a long time. You could have this infection for a month. But that's also what we're seeing in these patients. They so say they get intubated on day 10 of their illness, they're requiring another 10 days on a ventilator before they can even get weaned off the ventilator. And then they continue to improve from there. But people are sick for a long time. And what that means is that it's a long, that's a person that's in the ICU for 10 days or more. So that's a lot of resources to keep, each person going and alive and moving towards hopeful recovery. Also, if you just have these symptoms and are able to stay home, I know it seems daunting, but it's a long time to be completely isolated and quarantined. But please don't give up, because you can be infecting others during that whole time. So symptoms, you've heard the most common, like I said, cough, fever, shortness of breath. Those are the most common. Shortness of breath is this kind of feeling of needing to work to breathe. Runny nose is rare, but it is a possible symptom, and it's more common in children, as is nausea, vomiting, and diarrhea. So actually in kids, one of the studies I read was 50% of kids have diarrhea. So in kids, it's a lot more common that they're presenting, their first sign is nausea, vomiting, or diarrhea. Whereas it's a little not quite as common in adults. Sore throat is another common symptom. Fatigue or body aches, those are kind of common flu symptoms, but they can be symptoms of COVID-19. Headache and lack of appetite. The other thing with COVID-19 that's good to understand, you don't have to have all the symptoms. You don't have to have a combination of symptoms. You could have shortness of breath and no fever. You could have cough and fever, but no shortness of breath. You could have a sore throat and cough, but no fever. You don't have to have all the signs and symptoms to have the illness. So that's another good reason. Just assume you are infected. I think that's all I wanted to say. But I'm encouraged by so many of you in our community. I just feel like there's not that many who aren't taking this seriously. And I just also continue to feel so important that we educate each other. The more that we understand what's going on, the more that we can do the right thing for our community and for ourselves and for our world. And so please don't hesitate to educate those around you. Feel free to use the videos that I've recorded to just help spread. There's a lot, I feel the farther we get into this, the more clear cut and good education there is, the less hype there is. And yeah, blessings to you. Peace be to you as you're kind of developing different ways of life currently and figuring out different things. Just hope that you have